I'm open to Module 9, which is the last module in Week 4. As you've noticed, Week 4 also has 3 modules, just like Week 3 did. And then Week 5 and Week 6 will go back down to 2 modules a week. And that sort of levels it out a little bit better. So in Module 9, we're going to be covering Chapter 10, which is in the hospital, settings, procedures, and effects on patients. And so here's your to-do list, and here are the objectives. So we'll be taking a look at everything that happens in the hospital. A lot of medical care and a lot of self-care happens outside of the hospital, surprisingly, but a good deal of it still does happen inside the hospital, and it's important to take a look at what hospitals are like today, what it's like for a patient who's going through a procedure, a medical procedure, and what sorts of effects that has on them. So we'll be looking at some of the history of how hospitals have evolved here in the U.S. What did they start out like, and what are they today? There's definitely a hierarchical structure and organization to hospitals that's important to understand, sort of the who's who and what's what, and where do people go. I think that this is going to be a really important chapter for everybody individually, because if you haven't yet been to a hospital or had a procedure, you will in your lifetime, inevitably. And it's important to kind of understand how things operate for your own benefit. You may be in a position where you have to fight for your health care, or you have to fight for getting good health care, or you might have to fight a diagnosis, or you might not agree with a doctor, and then what happens? So I think this is a chapter that really can hit home and be pretty educational for the long term for most people. We'll be taking a look at the common goals of hospitals and healthcare professionals. Why do they do what they do? What are some of their goals and their strategies of doing so? Looking also at the importance and the purpose of an infection control committee. Every hospital has one, an ICC. This is a really important committee because hospitals are breeding grounds for infection. You're dealing with sick people. So sterilization and quality control is really important, and that's what the Infection Control Committee is in charge of. We'll look at some of the changes that have occurred in hospital procedures, like how things were done in the past versus how they're done now. Kind of what are the steps that are taken to make sure things happen safely, and patients don't get sicker from a hospital stay. It's never the goal for a patient to undergo a treatment or an operation or something and leave sicker than when they came. But obviously that happens, and so we'll kind of unpack that a little bit. We'll look at some of the relationships that hospital staff have with patients and what that means, as well as just being in the hospital, what that experience is like for patients. There's an aspect of depersonalization when you're a patient, especially when you're having a medical procedure. You tend to become that medical procedure, so it's no longer, relatable for you. It's, go take care of the diabetic in room 3. Well, that diabetic has a name. It's a person with probably a family and a history, and so a lot of it can be depersonalized, and it's sort of something that kind of has to happen for doctors because they're dealing with just so many sick people every single day. They can't get personally attached, otherwise it might impede them doing a good job. So that's where we start to get into some of the psychological components of burnout that happens in the medical profession. The medical profession has a higher burnout rate than other professions because you are dealing with very sick people often, and it's hard. People go into medicine and the practice of medicine with the hope of having answers, providing cures and helping people get better. And when that doesn't happen, it can be very defeating. So we'll look at some of the challenges that exist for medical professionals in providing treatments to their patients. And then looking at the flip side, what's the patient perspective? What does it mean to be a quote-unquote good patient versus a bad patient? What do each of those mean? And how can being a good patient actually be harmful? I know it sounds counterintuitive, but when we try really hard to be a quote-unquote good patient, we might be missing doing some really important things that are important for us, for our health as a patient. So we'll also look at patients' emotional reactions to hospitalization, coping with the hospital process of being a patient, and the role that healthcare professionals play in helping their patients to cope with that. So if I'm a patient and I'm having a surgery, I might have to spend an extended amount of time in the hospital to prepare for surgery or recover. And that can be difficult because, again, the patient is away from their comfort zone, they're away from their family, they're away from their job. They might be facing some hardships because of that. And so in comes a lot of what you already learned about with coping and how patients cope with that. Also, how do we prepare patients for medical procedures? How do we make sure that patients are fully equipped to deal with being in a hospital and deal with having maybe some complicated medical procedures like cancer treatment, which may involve chemotherapy or radiation, and may carry over actually into the home setting. We'll then look at some of the differences that occur when the hospitalized patient is a child, how children experience the hospital, how they view that experience, and the role that parents and family play in that. And then we'll look at a health psychologist in a hospital setting. Health psychologists are very often employed in hospital settings, and they tend to play the go-between in providing coordinated care for the patient. So sort of being the mediator between the doctors and the nurses and the specialty doctors like an oncologist or a radiologist, and they're sort of the one making sure that the patient is okay in the entire process and that the family is okay. So we'll take a look at that. And then we'll look at the tools used to assess, tools used to assess, that is totally spelled wrong, sorry, but the tools used to assess medical patients for psychological testing. So oftentimes we want to make sure that if you're a patient, you're about to undergo an important surgery, that you're psychologically okay enough to do so, because it might take a big toll on you as a patient, and we want to make sure that that patient isn't already severely depressed or have an anxiety disorder that might interfere with, for example, a surgery being successful. And then lastly, we'll take a look at some of the issues surrounding terminal illness. So what happens when an illness is inoperable, or you've done all you can and now it's really just a matter of time before the patient dies. All right, then we have the lecture slides, and there isn't a video that goes along with this module, just a discussion. We'll actually be looking at how healthy is your job. You guys are welcome to use your current job that you have for this, realizing that it's not your job you're going to have forever. But this chapter of the Longevity Project is really great because it talks a lot about the importance of picking the right job. So I think this is one that's going to hit home for a lot of you as you're getting ready to go into your careers and choose a career that is going to best suit you and be good for your health in the long term. So you'll want to complete the chapter assessment as usual, and score yourself and interpret that score. And then you're going to be looking at the termite data in the book to help explain the relationship between career success and health and longevity. Again, making sure that you're using examples from the termites. Who were the ones that had a successful career and how did it affect their health? How did it affect their longevity? Who lived the longest? What were the effects of workplace stress? And what is the self-healing personality? What does that mean? We'll look at John Holland's categories for personality type in occupational environment. This is basically a categorization of trying to match your personality type to what type of occupation would be best for you or best suited for you. So we're looking at all of that. And I think that this is just going to be a really great chapter in the Terman data that's going to help a lot of you maybe make good choices as to what career path you pursue. All right, so that rounds off all of the modules for this week. When you've finished all of the modules, you've read chapters 8, 9, and 10, along with the module 3, physiological module 3. You'll be ready to take your exam, which is due on the 4th, and that is exam 3. And that is it for this module. Please let me know if you have any questions. Best to email me. I respond pretty quickly to email. So it is a little better than using the Ask Dr. W in the Communications tab. I tend to not check that as regularly, so please just email me if you have any questions, and I'd be glad to help.